Well, for more perspective on the Ebola crisis in West Africa, we're joined by reporter Cynthia Areh from our partner channels TV in Lagos, Nigeria. Now, Cynthia, although the Nigerian officials have declared the nation Ebola-free, how much fear of the virus remains in Nigeria and across the nation and the region, actually?
Well, Nigeria is not actually Ebola-free right now in terms of being official, because 42 days since the last recorded case will actually be on October the 20th. But right now, there's no recorded case of the Ebola virus disease. The Minister of Health, Professor Chichuku, has reiterated that there's no known case right now, no reported case. But by October the 20th, it will be declared, based on WHO protocol, that Nigeria is actually Ebola-free, because that's 42 days from the last case that was recorded.
Now,
so right now, we're doing pretty well, doing very well, but it will be official on October the 20th.
So until then, we know that there were some measures that were put in place to ensure that the Ebola virus that came into the country at some point does not spread, and it looks like it was contained. What are some of the measures that are still in place up to now?
What are some of the measures that are still in place up to now?
There's still, centers are still open. The lines which were actually given, or the numbers that were given for the public to actually reach out to report any case or any suspected case, they're still very much open. There's still a lot of hygienic measures that are still in place right now, in terms of hand sanitizers, in terms of proper water that's been set up, in terms of taps that are they're still very much in place. Everything that was in place when the Ebola virus disease was a problem is still in place. There are still checks being done at airports. People are still being, thermal scanners are still being used literally everywhere, be it offices, banks, restaurants, schools. Everything is still in place. So even though we're almost in the clear and will be official on October the 20th, nobody's leaving anything to chance. So you could say it's a healthy fear. Everybody's happy that, there's no reported case, but nobody's leaving anything to chance.
At some point, we know schools were closed, and then they were reopened later. But how are the parents reacting to that? Are they comfortable sending the kids to school?
Well, initially, they weren't comfortable because they didn't feel the government was ready or had put in place satisfactory measures to ensure that the kids were safe. But now it's not all schools in Nigeria that have resumed. It's being done at a state-to-state level, in that schools in Lagos, for instance, have resumed, but by next week, schools in Kwara and other states will resume when they've made sure that they are ready. And now that even the schools have resumed, if you paid visits to some of those schools, you will see a lot of taps there, jerry cans, just in case anything happens with the water supply. Thermal scanners, like I said earlier, are also in place. Sanitizers, and also seminars are also being put in place to educate both the students as well as teachers on how to prevent the Ebola virus disease. So right now, parents are content in those states where schools have reopened, but some haven't reopened just yet because they want to make sure that nobody's life is going to be put at risk. So yes, I can say now for sure that parents are actually comfortable, and also staff or teachers' unions are comfortable as well.
Very quickly, how has the Ebola virus affected or impacted the travel between Nigeria and the other countries in West Africa, back and forth?
How has it affected travel?
Yes.
Well, in terms of travel, nobody shut their borders. It's not been done here, just like America has said they're not going to shut their borders either. But what's happening is that airport checks are being done. Thermal scanners, the authorities in place are fully and properly kitted so as to ascertain if there might be any potential Ebola virus disease case. So as long as Ebola still exists in the world, it can happen anywhere. So it's not a case of shutting out this country or isolating or stigmatizing one country or the other. Measures are in place in the airports to ensure that people who might be potential Ebola carriers are identified on time. But as regards shutting shutting out other members of countries affected by the Ebola virus disease, that has not been done by Nigeria.
Well, Cynthia, thank you very much for your fabulous reporting there. Okay, that's Cynthia Areh, who's a reporter with our partner channels TV in Lagos, Nigeria.